I wonder if we're a bit overwhelmed. Overwhelmed, you can hear the H in it. I wonder if we are today, in a sense, of being crushed by events. We've got two big issues which are overwhelming us. Number one is the migrant issue. Today, for example, there are boats seen in the channel, and HMS Valiant has been sent out to intercept them. I presume, I hope, to save the people who might be in trouble. That is our mission. Pushing back, this is illegal under international law, though there are efforts to change this. So what do we do about migration? What do we do about refugees? Are we in a position of getting overwhelmed? The other thing that's overwhelming us, of course, is the whole business of COVID and the Omicron or Omicron. It depends on your pronunciation. If you're going to have a modern Greek pronunciation, it's Omicron. If you're going to have an Erasmian Greek pronunciation, it's Omicron. I find it extraordinary that that somehow in Britain we've adopted a modern Greek pronunciation. I'm rather charmed. But there are problems with the NHS. We know this. Constant complaints that when you call up a GP surgery, you can't get through, or you're triaged by a secretary, and then you're left waiting, or you're told to call back tomorrow morning at 8 o'clock, and you spend an hour and a half on the phone and you still can't get through, or you only get a telephone call or a Zoom call, and important symptoms are missed. And people are then forced into hospitals. So the hospitals are doing the sort of jobs, they're picking up the sort of jobs that ordinarily we would pick up in the community. Now, if you start looking at the figures, which is always very interesting, we know that Matt Hancock promised 6,000 new GPs by 2025. That hasn't happened. We haven't seen that increase even proportionately at this moment. What we've seen is more GPs leaving the NHS. Actually, the figure that we apparently need is 50,000. So talking about getting 6,000 new GPs by 2025 is nowhere near addressing the hole that is appearing in the NHS system. We have to fix the NHS, which means, I think, we have to look at the whole of our healthcare provision. We need to integrate private healthcare and public healthcare. So those people who want to opt for private healthcare and have the money to do so can pull themselves out of the system, so they're no longer a strain, adding extra strain on the NHS. We need to find ways to release what is good about the NHS. Anne Widdecombe did an interview yesterday, I think, where she talked about the Omicron variant. She calls it Omicron. She follows the Erasmian pronunciation. I must say, I'm impressed. And today we learned of 75 new cases in the UK. But she talked specifically about a panic in government. So wearing face masks, she says, doesn't do very much and is a mark of panic. We've got to do something, so let's do this. This won't have a huge impact. Actually, it will have a huge impact. I think she's wrong. I've thought she's wrong for a long time. In fact, some time ago when I came off the TV programme The Circle, there was some talk about doing a small show on BBC and having sort of dinner and a chat with Anne Widdecombe. I'd have enjoyed that. I think she's an interesting lady. I don't share all her views, but I like her. In fact, I don't share very many of her views, and I find the thought of having dinner with Anne Widdecombe really quite attractive and challenging. Please pass the salt. But the fact that you don't agree with somebody doesn't necessarily mean it's going to be a bad experience. In fact, it can be a very positive experience. We want to exchange views. And Anne Widdecombe is somebody definitely that people should stand up to. She's a very formidable lady. And what she says yesterday in her interview, she was very persuasive. She talked about Boris's panic. Mr. Macron talks about Boris as a clown. Boris showed us these assaults very, very well. He fits. He's a very good punch bag. It doesn't mean that these things are true. I think there is an element of panic going on. I concede that. But I think that it's the wrong signal to send. The signal to send is that we need to, as a country, come together and pull together. Now, we need to be consistent in the way we behave. Actually, Boris is being consistent. We need to be quick in the way we behave. Boris is being quick. And even if we don't approve of the idea of vaccination, there's no real reason why we shouldn't follow the principles of masking up. Even if we don't wear a mask, we should keep away from other people. We should keep our distance. And that way, maybe we can reduce the spread of Delta, the spread of Omicron. We need to be more community-based. We need to focus on what the community needs rather than what I need. And I am, of course, horrified by the latest stories that GPs are now being told that their surgeries are going to be paid for prioritising the booster injection. Good idea. At the expense of checking up on people who are over 70. Bad idea. However, we are informed that checkup thing is about box ticking. And box ticking is definitely something I would approve of being thrown out of the window as fast as possible. So if box ticking is going to be reduced for greater service, that is something to applaud. We need to look at what is positive rather than focus on what is negative. And we need to stop all this naysaying after a decision has been made. We need to find ways of implementing the decisions that are there, rather than constantly wringing our hands and saying, oh, you shouldn't have done that. Actually, we need to support the decision makers. That said, we also need to make sure those decision makers are doing the right thing. So I should give a shout out also for a person called Ever Evolving Zay, who runs a website focused on well-being. So there's a shout out for him. Have fun. Do follow my channel and do ring the bell. Bye bye.